to go straight into an interview and let you know what you need to know about this coronavirus, because I tell you, it is scary, and it has been declared by the WHO as a, what is it, public emergency? That's right. Joining us live now in the studio, Dr. Martin Osumba. He's a public health specialist currently working with the Research Triangle Institute, RTI. Dr. Ari, welcome to the show.
Thank you so much, Jeff, and thank you, Vicky.
Thank you for coming in. You know, as much as this is the information age, we still don't know very much about this disease and this new virus. Still, how it's transmitted, we're not very clear on that. So how should people kind of prepare themselves for such an eventuality?
Right, and it's not a unique place to be in, especially in the context of an epidemic such as this.
Yeah.
Where, first of all, the agent of infection is an entity that we refer to as new, and that's why the novel tag is added to it. And, you know, it's new in the sense of the organism itself, but also new in terms of us having an understanding of how is it transmitted, either from humans, from animals to humans, or between humans and humans. However, that said, I think for the nCoV right now, as we call it, we have enough information that's coming out of Wuhan, China, that there is very potential that there was a transmission from the animals to the humans. But that said, we are beginning to see also human-to-human transmission. And what is interesting also is that the first cases that were reported in China towards the end of December last year, the first two cases actually didn't have any connection with the market that is sort of branded as the reservoir of the virus. So it suffices to say really right now that we have a sense and an idea of what the virus is like in terms of the genome sequencing of it. We know its relationship with the animals.
Which animal, doctor? Which animal was that?
So for animals, remember, there's no name that we can place as at now, like we did with the MERS and the SARS.
Right.
And that's the effort that's going on currently to try and establish, is there any relationship?
Dr. 300 plus deaths so far.
Right.
And countries, how many? 24?
24 countries right
and
now.
Counting. And I noticed in the alert that they gave, Africa is not included in any of these countries. None of African countries. Or is it just suspected cases, or it's not confirmed? Is that why? Or
right. I know there's a lot of surveillance work going on in the whole of the African continent. So we know Africa CDC is up and, you know, tuned up in terms of, you know, surveillance on this disease. We know national entities have been tipped off to up their surveillance antennas, as when we received the notification from WHO making sure that, you know, stating this situation as a public health emergency event, right? And that essentially what it does is that it makes it triggers responses from national states to heighten, if you may, their antennas in terms of disease surveillance. So looking at the Africa state, to your question, Jeff, noting that we have not yet seen a death, but have recorded suspected cases, I would say is a good thing. Good thing in the sense that it seems that the African states are actually have put surveillance on the disease, number one. Number two, that there is not much traffic coming out of the epicenter into Africa, all right? But are we out of the woods yet? No. And I think that's where the question is.
And speaking of which, how deadly is it? Because you see reports saying that it's spreading much faster than diseases like SARS, but it's not killing as fast.
That's right.
So how deadly is it when you're thinking about it in that way?
Yeah, so I think China has done a good thing so far in terms of the transparency. And the whole globe sort of seems to be happy, if you may, with the kind of information that we're getting out of China, meaning that we are able to tell or characterize the folks who are susceptible. Okay. We are able to count with some level of certainty the folks who are actually affected and the folks who are dying. Now, if we look at those numbers, then from the SARS epidemic right now, the mortality rate is about 2%. If you compare that with SARS, it was 10%, and with MERS, it was about 33%. So what we are concluding about the coronavirus is that the virulence is not as much as we saw with SARS and MERS, and the mortality is also not as high.
Yeah, Doctor, right. I just had a friend who came in through JKIA this evening.
Right.
And they have all kinds of screening going on. The same thing they had for Ebola, and right. They check your temperature if it's above 39 or whatever it is.
Right.
Are we ready for it? And by the way, we still have flights coming in from the China region, right?
Yes.
We still have flights coming in.
Yeah.
So, are we ready for this thing?
It's a hard question even to sort of decide of whether we're ready or not. But the question we need to answer is, what preparedness are we putting in place to make sure that as and when the numbers begin to rise, either in country or continentally, that there is a response. All right.
Yeah.
Right now, we are looking at measuring temperature as sort of like the screening test, if you may. The challenge we have with that is that, for example, pregnancy itself can raise temperatures, if you're to test folks who are coming through points of entry. So the thing we are doing, like what's going on in a Citizen right now and in, what we're calling the risk communication is what is key. Why? So that folks who feel sick, even if you have been screened, you have been found to be, feverish or not, and, we let you go, it's important that you be aware of the other symptoms that relate to the disease. Why? So that once they begin to show, you present yourself. I think that's the most important thing.
But I think even scarier about this disease is the latency period. 9 to 14 days. So, you may not feel sick, but you can still transmit the disease. So how do you kind of reconcile the two?
Yeah, it's again the battle with the disease, if you may. Right now, we know that there is transmission, human to human transmission, that's going on even with asymptomatic people. However, the flip side and the good thing about it is it's not as pronounced as what we see with transmission between symptomatic folks and the susceptible people. And this is demonstrated though actually by what we are seeing from the hospitals, that the healthcare workers who are in contact with symptomatic patients.
Bottom line, doctor, you don't seem very worried, huh? You don't seem, you think we can contain this?
I think we can. It is, you see, when you're looking at an epidemic, really, there are 5 areas that we need to be very clear about. Who is at risk, all right? Those who get infected, what is the system in country that has been put in place to make sure that detection is right and diagnosis is right and plugging into care is right. And then number 3 is looking at who is dying. All right, because in between the susceptible and the dying, there could be factors there that as a country and as a medical system, as a healthcare system, we can intervene. All right.
Yeah.
And then finally, of those who are recovering, what's the long-term, if any, effects of the
But doctor, so far 304 dead, more than 12,000 cases in China.
In China alone, 14,000.
14, right? It's up to 14. So
effects.
Right. Wow.
Yeah.
Cause for concern.
Yeah.
Absolutely.
Yeah.
So making sure those systems are in place.
Exactly. Dr. Martin Osumba, thank you so much for your time, for joining us from the Research for Triangle Institute, RTI.
Thank you so much.
Thank you for your time. I'm sure we're going to be talking to you in the next few days or few weeks.
Certainly.
As we